So somewhere along the journey, you were just speaking, you had a mindset shift,
Hmm.
right? To see these genetic test results, not just a source of anxiety, but as a source of strength and opportunity. What decisions did you make as a result of your genetic test findings?
Yeah, in terms of really big decisions, I guess you could say. I mean, big decisions in cancer prevention are often a prophylactic surgery, right? And so one of the first things I did was to find a gynecological oncologist. So once I started digging into my Lynch syndrome mutation, uh, I learned that I had up to a 49% increased risk of endometrial cancer. And then there's also an increased risk of ovarian. And so I started reaching out. In fact, I used a Facebook group. I joined the various support groups that you can find for your genetic mutation. So if people are listening and aren't sure where to start, a good place to start is Facebook support groups because they can be a wealth of information. And so I reached out to some folks on a Lynch syndrome board or group, and I ended up finding my gynecological oncologist here in Nashville. And it was a great decision because she was one of the I guess you could say, one of the best reputations, I guess you could say, for this space. She was very familiar with Lynch syndrome. She'd had several patients in her past. She was one of the doctors. Her name's Dr. Laura Williams. She's no longer at Stonecrest, but she has since retired. But she had set really the standard for women having hysterectomies in terms of their program and in preparing you for the surgery and what all the work that went into that. And they did a great job of communicating. And so I knew I was going to the right place in preparing myself for that. So that was one big decision, was having a preventative surgery. Now, most of this big decisions are really relating to prevention and screening. So I talked about prevention from the endometrial cancer risk with Lynch syndrome, but then with my colon cancer risk, because there's a slight increased risk with CHEK2, but also for Lynch. And Lynch, it can be up to 44%, depending on your specific mutation. And so I was already on a 5-year plan for my colonoscopies because I had a grandfather who had colon cancer. And so I was already on that 5-year plan. And when I reached out to my gastroenterologist, and he's like, all right, let's get you in, let's get this process going. And he recommended every 2 years. Some people with Lynch syndrome might have even more, maybe a higher penetrance mutation. And so they go annually. If you also have Lynch syndrome and you have polyps at every colonoscopy, they might have you do it even more frequently. So, it's not a small change, right?
Yeah.
Going from the 5 or 10-year plan, depending on your risk, to now going once every year or once every 2 years. And then every 4 years, so every other colonoscopy, I have an endoscopy because there are other GI cancers associated with Lynch syndrome as well. And so, that was a shift. So making that decision to then reach out to my gastroenterologist, who fortunately also was pretty familiar with Lynch syndrome. And so we got on a cadence and got the ball rolling there. And then the last one was, obviously, I was already on kind of alternating screening for my breast health, right? So prevention of breast cancer. I do breast MRIs and mammograms. I alternate them every 6 months. And then other things that are related to it, like some skin cancers associated with Lynch as well. And because there is some family history with basal cell carcinoma, I do an annual skin check as well. And so getting your head around all of these screenings, it's significant. I'm a few years into it and it gets easier, I think, but at first it can be really overwhelming. I think just that skin anxiety that happens with each of these visits, that does get better. But I think cost can often be a factor as well for people if you have, maybe insurance that is a high deductible or you have challenges with that. So
Yeah.
I hope that was a really long-winded answer to your
No,
question.
I call it robust.